really nice normal lip anatomy that's just lengthened out a little bit, and that is because never done filler here. There's been no filler to change this at all, and that's very, very, very atypical. We're here with Wendy, who's 63 years old and made the trip to see us. We were talking almost 10 hours. Thank you for coming to visit. And we met about 6-7 months ago, I think, for the first time, and kind of chatted through. Wendy's in a very unique and wonderful position that she'd never done anything. We did Botox to her glabella one time, but otherwise no filler, no procedures, no non-surgical things, nothing. So it's just a blank slate for us. And when we first talked, you sort of mentioned like you're hooding upper lids and eye bags and lower face and neck and kind of all the normal things that everybody has concerns with, and very sort of like textbook as far as like aging and like time frames. And so we're just in a really good spot, and we're gonna rejuvenate kind of everything today, just in small, subtle ways. That's sort of my jam, and I think you resonate with that a little bit. And so that's going to be our plan. And you know, when I talk about some of the key aging things, a lot of that has to do with what happens with the combination of how the upper face blends into the lower face, and we kind of talked about those reasons a little bit. I just want to kind of show some of those. That all right? Okay. A little bit? Okay.
Sure.
You know, Wendy has a little bit of sinking of her brow, and it's not as much the middle section, right? It's more this sort of outside corner, and this is pretty typical. And so we really want to be able to address this. This is that roof fat pad that we talk about right here. And this roof fat pad just kind of, as it sinks over time, kind of creates some of that hooding. And so, you know, I like to elevate the roof, and then sometimes I'll over exaggerate and look just to kind of see what the contents underneath are. I'll look for lacrimal gland filling the space. I'll look at what the fat pads around are. Here's a little bit of hollowness up here that we'll address by moving this fat pad over. But overall, like really solid anatomy and very normal change with this outside corner sinking. So we'll be able to lift that up very subtly with an incision hidden way back in the hairline that will be totally invisible back in the scalp. There's a little bit of extra skin up here that we'll address. And then, you know, with that, there's a little bit, we were talking about this. This is the dynamism of ptosis. Ptosis means sinking of that upper eyelid, starts with a P, P-T-O-S-I-S. And, you know, Wendy's got a little bit of a size discrepancy in her eyes, with the right side being a little bit smaller, which is most noticeable. We're talking about in the morning and the evening and photographs, but throughout the day, you correct it pretty well, right?
Try to.
Yeah, exactly. And that's just by kind of being in a good, we call like sympathetic nervous state, fight or flight. Like when you're revved up and activated and going, your eyes tend to open up a little bit. So it makes it a dynamic kind of moving target, if you will, to hit. And thankfully we're really good at it, and we'll figure that out, but it's going to be kind of like subtly correcting the baseline position of your lid, so that when we do have those moments of like resting, you know, tiredness, that we don't get that sort of ptosis, and we have that nice symmetry at just like conversational levels, right? So that will fix that in the right upper lid. And then in the lower lids, we have some pretty traditional changes with just like here's her lateral fat pad in her lower lid, and here's her medial fat pad, and then this is what people call a tear trough ligament, right? So this is bound down, and everything above it's coming from inside of the eye socket and coming forward. And so we'll take these fat pads and we will move them down to fill this space here, this tear trough area down below. And we'll do that all around. That's totally scarlessly done through the inside of the eye. I'll move this lateral fat pad to fill this hollowness here. And so we kill multiple birds with one stone. We get rid of the bags that are under the lids, and we move them down into here. We'll then volumize some of the fat pads that have deflated in the cheeks a little bit, because we have this nice groove that extends down here as well. So I'll be able to volumize these fat pads, and I will lift them back up, and I will put them back together so we don't have the hollow in between. And so this fat pad, this triangular shaped fat pad here, will then meet back up with the lower fat pad in the cheek. So this is the mid-face lifting part of putting these back together and making sure that they're appropriately volumized. And then we start moving down into sort of some lower face changes. This horizontal line on Wendy's lip here is pretty typical. And this happens as the upper lip lengthens and the muscle there starts to get out of its favorite working length a little bit, and it starts to kind of pleat or contract right here. And this gives us, people call a line of declaration or a line of delineation, and that tells us about where the muscle's working, and it's a bit off the bottom of her nose where we want it to be. And so we know that there's just been some natural lengthening of the lip, and we were just talking about this, we being my fellows and I were talking about this beforehand, how it's pretty mild and it's not that significant, and overall like a really nice normal lip anatomy that's just lengthened out a little bit, and that is because never done filler here. There's been no filler to change this at all, and that's very, very, very atypical. Most people have had filler in their upper lips, and it's migrated through the muscle, and it changes the way it looks, and this happens way earlier than 63. And so we're doing these procedures on people in their 30s and 40s now because we're prematurely aging our lip with filler. This is just a very, by definition, the most natural sort of aging we can have on our lip. So it's just sunken down a little bit, and with that we'll be able to do a lip lift to lift this up, but then we start looking at the corners, and we'll also notice that Wendy's corners are down a little bit, but not too bad, not that significant. Normally there's this big pile of filler sitting here that's driving the lip down, and so we get a bunch of hooding at the outside corners, and she doesn't have that because there's no filler there. So fun and lovely, and it makes that procedure really, really nice, and it'll be really rejuvenative with that lip lifting procedure. And then we get where things get a little bit more complex. So I'm just going to turn you just a teeny bit this way. And so as we get into the different parts of when we start looking at what happens with I'm going to do a deep plane extended facelift on her. And I'll do a couple little modifications with that to help kind of define her jawline a little bit better. But we start to see how this, you can tell how this is really bound down back here. This is what we call her fixed smass. And you can even see a change in how the skin changes up here. This becomes very mobile. We call this the mobile smass. It moves quite a bit. This is more fixed, right? And so this is her zygoma, or her cheekbone here. And so I'm going to access this mobile smass, and I'm going to lift it up to stack volume and redistribute and recreate a jawline and everything along this sort of fixed smass area back here. And we'll get all of these areas sort of elevated together. We've already talked about her brow, her midface, gonna get her area around the corners of her mouth, and we're going to get her lower face as well. You can see this is her buccal fat area. This is her jowl fat pad down here. These are all important things to understand and differentiate, because we want to lift this up. And then we start getting down into the structures of her neck, because here's her actual jawline, which the jowl fat pad is sinking below, but then you can kind of appreciate this deep area down here. This is her submandibular gland sitting right here that's coming down. And normal conversational level, it's not that significant, but if you can put your chin down for me, as we put it way down, it starts to bulge forward and starts to meet up with this muscle, the sternocleidomastoid, and gives a lot of this fullness here. So if we want to restore this, I'm going to lift you back up. We're going to take her whole neck anatomy, and we're going to lift and set everything back up and in sort of the floor of her mouth, if you will. We're going to recreate the jawline, the floor here really tight, and then we'll get the whole sort of front section redraped naturally after that. But this is our anatomic key down here, is to get all these things lifted and elevated back up. We're going to do that in a very, very stealth fashion, and then we'll use some volume, some structural fat transfer to sort of augment some of these areas of volume loss around here. When we start to see these smile lines form, we know that we often have some loss of the buccal fat support, which she has because the buccal fat starts sitting lower down. So we'll be elevating and supporting all that through here. And then, of course, last but not least, we'll kind of tighten up and fix the front of her neck to make that anatomy really tight and structural, so that when we do our lifting and elevating, we have this nice, the hammock, as I say, is repaired. We don't have a hole in the middle of the hammock as we try to elevate it from the backside. So, and we talk about this ironically, at the very end, we'll be doing a laser resurfacing. We're going to do a few different things. We talked about some brown spots, some wrinkles, but overall, that's going to be one of our more dramatic, one of my more exciting parts of this. Is that is going to be just a really, really nice qualitative change. Nothing nice. Quantitative there, just new, stronger, smoother skin that will, kind of, as time ticks forward, when we talk about changing your aging curve, it's going to really change it. It's going to be a lot stronger going forward. So
we got a good another 20 years.
Yeah, there we go. We talked about the detailing. You call yourself the old truck, right? Yeah. Which I don't know that I agree with that completely, but I like the idea of detailing it for sure. A few little minor refreshes along the way.
Yes,
but
yes.
Thank you for sharing very much.
You're welcome.
Yeah, really appreciate it.
I'm excited.
Yeah, me too.